So therefore, before injecting anything, take multiple images. There can be the standard images like AP, oblique or lateral, but or even a 5-degree tilt or a 10-degree tilt or a 15-degree cephalocaudal is needed to confirm. Because if you are in the position, you are in the position. If you are not in the position, you can get that illusion that you are in a position in few images. Right? That is one. Now this is again which is often asked is dye. Dye confirmation is a must. We follow the basic principle. Wherever there is dye, there is going to be drug. You might get a perfect image, but if they are not putting in the dye and the dye is not getting good spread, that is one. Second, dye spread is needed to rule out any sort of complications. You can be in the blood vessel, you can be in the CSF. So for all of that thing, and whether you are actually able to target the intended area, intended route, is confirmed by the dye. Fine. With that background, let us go forward. Now, these are the standard images: AP, oblique, and lateral. So what I have mentioned is treat the patient, not the table. So what I have seen is people when they start off, they are obsessed with the degrees. कि 5 degree करना है, 10 degrees करना है. It is not based on the fluoroscope. It is based on the patient and the image that you get. So once you strike a fluoroscope, when you get that image, the image will decide whether it is a perfect AP or oblique or whatever. Right? So even during the discussion, वो बहुत होता है 5 degree रखना है 15. No, the patient decides it, not the fluoroscope. So during the cadaver also, during the cadaveric workshop, we will also see, you will, in some cadavers you will get it at 5 degrees, some cadavers you will get it at 10 degrees. So we go for the image based rather than the table. Okay. 3 cardinal that we have talked about, we have already discussed. So we will be going, mostly we will be discussing when with regards to spine would be an AP, oblique and lateral. Now firstly AP. How do we identify AP? We take the structure in the center. So what is there in the center of the spine is the spinous process. We take any lateral structure and see whether they are equidistant or not. So on the sides would be the facets or the pedicle. So the point is the spinous process should be equidistant from both the things. That is one. How should we count the vertebrae? Top to bottom, bottom to top? Anybody? Both में तो बहुत radiation हो जाएगी sir. Huh? Agree, disagree? Exactly. So it is top to bottom because you come from neurosurgery background. So you understand that conditions like transitional vertebrae is more common than you think. And most of the times our intervention fail because we are not injecting at the right level. Therefore, how I approach things is that when I decide the level, rather than going by the traditional L4, L5 or whatever, I like to do it the last disc, penultimate disc or the second last disc. Because that makes my job easy. Because when I'm starting off, I will be sure that from the top and the bottom, I am at the right spot. Ideally, yes, if you feel, because when we go for MRI, sometimes these things like transitional vertebrae are not well appreciated, and it is only on the table that you realize that something is fishy. Then you do the entire counting, and then, as somebody said, that then you will have to go from both top to bottom and bottom to top, and then you have to plan accordingly. Okay, place a marker on this. Yes, that is be innovative on table. When I say be innovative is that you cannot be a set thing that, okay, always top to bottom or bottom to top. If you feel that the anatomy is not clear or you are not getting the transition, the typical vertebrae, take that liberty of taking a few shots. but the intention is to reach the right target. Then we make it oblique and then we get the Scotty dog. Okay. Books have mentioned talking about getting Scotty dog at 15 degrees to 25 degrees. Some have mentioned about 35 degrees. But as I told you, the basic purpose of getting the Scotty dog is that we need to be sure that the transverse process is within the vertebral body. The patient will decide what is the degree at which we are getting. Thank you so much. The timing was perfect. Okay, so right now we had the patient who was being placed like this. This is AP. Okay, can I get a volunteer? I'll make it more interesting. Can somebody just come? Please, I. Okay. So this is how the patient is, right? You have to see here. So how will you just? So this is exactly the position of the spine. We have made it oblique. We have made it Kevlar or border and this. So the ideal thing would be like this. So if this is the foramen, this is the eye. And eye for fluoroscopy is the eye. So eye has to be in direction of the foramen. So if our target is this has to be the direction. So how do we achieve it? AP, then oblique, then this. If we are not getting a crisp image, we make it, sorry sir, flat or border. Clear? Right. Now if that concept is clear, agar aapka right, bas. If we have to go for sacral roots, that is the S1 root, this has to be the position of the feet. I hope you got it. So it is just AP because the direction of the foramen is like this. So eyes are in the direction of the forearm. Any doubt? Here?
So can you take a pen to tell the direction of foramen?
Yeah, no, sir. Yeah. This is the direction of the forearm. So this is the direction of his eye. Right? This is the direction. So this automatically you see sir की neck change हो गई. और अगर करना होगा तो he will have to bend like this. Yeah. Here, अगर facet है तो it will be like this. So if you are the
camera थोड़ा सा ऐसा हाँ. That way, I mean yeah, you're showing the position.
So this is this. This is what. But the concept is there because when we go through the cervical region, the direction, because the direction is different, the C-arm position will be different. But the basic concept of aligning the foramen with the C-arm remains the same. Clear? Thank you so much. So once we do it, yeah. So about the squaring part, so we need to remove the parallax. We need to get crisp images, and probably during the practical thing, I'll be able to demonstrate it further. One more thing is when you're trying to get the parallax, remove the parallax, try to concentrate on the vertebral end plate of that particular level. Do not try to square the entire vertebrae. That is practically impossible and it will take a lot of radiation. So if your target is whatever procedure that you do at L4 level, so L4 and L4 inferior plate you are trying to do it, so just try to remove the parallax of that particular level. Don't try to do the entire spine. Just 2 minutes mein khatam kar do. So this is what is the basics. So this is about the Scotty dog, which we have discussed. This is again the pedicle part. So everything what we will be talking about would be with in relation to the pedicle, right? Can I get a pointer, sir? Just 2 minutes and I'll finish this part, and then we'll break. So everything, even if you are not able to see, okay. As we talked about, the most prominent part is either the spinous process, and second is the pedicle. Right? Below the pedicle, is the spot for the foramen. This is the pedicle, this is the site for the foramen. This is the pedicle, superior, this is the site for the facet. Pedicle above is the site for any intradiscal procedures. Okay, quickly, एक second. So that is fine. So this is, I'll just finish this. So this is the classical Scotty dog, right? What is this ear of the Scotty dog? This is the part of the superior. This is articular process. This is a superior articular process. Then there will be the eye of the Scotty dog is the site for the median branch block. Scotty dog, articular process, median branch. This is the site for facet, intra-articular facet joint injection, right? And this is the site for transforaminal. So basically you don't need anything. You just need to concentrate on the pedicle, below the pedicle foramen, pedicle superiorly and medially is the facet. Right at the eye of the Scotty dog is the yeah. And if you have to do any percutaneous procedures for the disc, you enter through the superior part of the pedicle. I think we'll take a break, sir, and now we will continue later. Fine. Fine. Thank you. We will revisit the cervical.
So thank you, Dr. Dhruv, and we will have a inaugural ceremony of this workshop. And Dr. Rakshay, please. I welcome Professor Kale, our department head of the Department of Neurosurgery, and Dr. Kamran is here, who's the chief, and Dr. Vijay Sharma, who's a faculty in charge of our Cadaveric facility. Both are professors in Department of Orthopedics. So, Dr. Rakshay, please take over.
Hello. Good morning to one and all present here. I welcome you all to witness this amazing and unique cadaveric workshop for neurosurgeons on pain and peripheral nerve blocks. Before we embark on this journey together, I would like to invite our respected dignitaries onto the dais. First of all, I would like to welcome Professor Kale sir, who is the head of our Department of Neurosurgery and the organizing chairman of this workshop and symposium, onto this dais. I would like to request Dr. Datta Raj sir to felicitate Professor Kale sir with a bouquet as a token of our gratitude. Thank you, sir. Next, I would like to request Dr. Kamran Farooqi sir, who is the Chief of Trauma Center, AIIMS New Delhi, and Head of Department of Orthopedics. Thank you for coming, sir. We'd like to felicitate Dr. Kamran sir. I would like to request Dr. Ramesh Dodmani sir to felicitate sir with a bouquet as a token of our respect. Thank you, sir. Now may I request Professor Deepak Agarwal sir, Professor Neurosurgery and the director of this workshop and symposium, to grace the podium with on the dais. I would like to request Dr. Ramesh Dodmani sir to felicitate sir. Thank you, sir. I would like to now request Dr. Vijay Sharma, faculty in charge of Advanced Cadaveric Skills Training Center at AIIMS New Delhi, to grace the podium, and he is the professor of orthopedics, sir. Thank you so much, sir. Finally, I would like to welcome Dr. Ramesh Dodmani sir, who is the additional professor of neurosurgery and the organizing secretary of this workshop and symposium. Thank you, sir, for being here. Pain, as we physical pain, as we all know it, it is a sensation we have all been through. It is an essential part of our life, but we don't want it without reason, do we? Pain is meant to protect us by warning us of the dangers that may lie ahead. But if the pain itself puts us into misery, then we are better off without it. Just like the famous Japanese writer Haruki Murakami said, pain is inevitable, but suffering is optional. And we as neurosurgeons are just about to learn that. I would now request the dignitaries on the dais to start with the lighting of the lamp and the Saraswati Mandana.
शिव विष्णु गजानन जिन चरणों को सेवते थे सूर्य ब्रह्म शिव विष्णु गजानन जिन चरणों को सेवते हम शिशु है अज्ञानी माता किन चरणों का प्यार दे मूरख हम नहीं जाने जननी पूजन वंदन ध्यान को मूरख हम नहीं जाने जननी पूजन वंदन ध्यान को आदि शक्ति कर क्षमा हमें आदि शक्ति कर क्षमा हमें पूजा के उद्गार दे
Thank you very much, sir. I would now request our Professor, Department of Neurosurgery and Director of the Workshop and Symposium, Professor Deepak Agarwal, sir, to enlighten us about this workshop and symposium. Thank you, sir.
Good morning to all of you, and thank you for coming. I thank Professor Dr. Kale, Professor Kamran, Professor Vijay for being here and gracing the occasion. We had a pain workshop last year. This was a conference come workshop, although there was no cadaveric workshop. So we did on live patients, and that was very well received by neurosurgeons because we felt there was a lacunae uh, for pain training in neurosurgeons. You know, that is one of the very important, and day in, day out, we are seeing pain patients. So only thing which we realized was the cadaveric part was missing, because you learn everything you see on the patients also being done. And that day also we called Dr. Dhruv there, and we did around 20 patients plus. But unless you do it yourself, you don't remember. So for that, I think the missing link, we decided we'll have a cadaveric workshop specifically for neurosurgeons and allied specialties. And that is why it culminated after 1 year into this workshop. So we are having, because of the overwhelming response, we are having it over 2 days. This same thing will be duplicated tomorrow. So I again thank you all. I hope that you go back with a positive energy and you can replicate whatever we teach you today. Thank you so much. Thank you.
Thank you, sir. I would now like to request Dr. Vijay Sharma, faculty in charge of Advanced AIMS Cadaveric Skills Training Center and Professor of Orthopedics. Thank you, sir.
Good morning, respected dignitaries on the dais, senior faculty members, colleagues, and delegates. On behalf of ACSST, which is the cadaveric lab here, I welcome all of you for this. I can see it's a unique workshop, but I'm surprised why only for neurosurgeons. I think a lot of there is overlap with orthopedics. I think orthopedic surgeons should also, because a lot of them, they are interested into spine and pain also. So it should be there for orthopedic surgeons also. I think availability of cadavers was a big problem this time, and I compliment, I think it was all the effort of Ramesh. He talked to anatomy people, and we could arrange more cadavers. Otherwise, we were facing big problem this time with the cadavers. And so if you want to have more knowledge about and the more number of courses this year, you can go into ACSST site. So there are, every month there is neurosurgery course, orthopedics course, and other courses. So if you are interested in doing more courses, then you can go on the site. So I appreciate the effort of all the faculty members. Most of the lecture I heard of those, it was really very informative even for all of us. So I appreciate the efforts by all the faculty members, and just for one purpose, that is dedication towards teaching. And I request all the delegates to learn from this workshop and try to use the skills for the benefit of all the patients. Target is to benefit all the patients, right? So again, I congratulate and I thank all the organizers for organizing such a unique workshop, and my best wishes to all of you. Thank you.
Thank you very much, sir. Now I would like to invite Professor Kamran Faruqi, sir, Chief of Trauma Center, to enlighten us with his warm words. Thanks.
Thank you, Ramesh and Dr. Deepak for inviting me to this workshop. We are fortunate at Trauma Center to have this facility, cadaveric facility. I mean, we are running courses throughout, and thank you, Dr. Vijay, for taking over as the in charge of ACCST, and because it requires a lot of effort, you know, arranging everything, the infrastructure, the instruments, the cadavers, maintaining them. So it is a tough job, and I'm happy that Dr. Vijay Sharma has taken over, and I hope that we'll have a regular tie-up for the cadavers. And I'm very happy actually. Department of not just Deepak Agarwal, but actually Department of Neurosurgery, they're quite active with the blessings of Professor Kale. I mean, they're having this some or the other cadaveric workshop at Trauma Center around the year. So I mean, all those guys. Especially neurosurgeons, or even for that matter spine surgeons, because even I'm a spine surgeon. Even orthopedics is having a lot of spine workshops throughout the year. So those of you who are interested, you can just and circulate among your colleagues and friends to look at the ACSST website. There are a lot of courses being announced around the year. So we have practically, I mean, Deepak is also a member of ACST, and we got a calendar. So it'd be nice for junior colleagues or even senior colleagues for that matter. I mean, myself being a spine surgeon, I'm not really been exposed to these pain procedures much because busy institute like AIMS, we don't have time for this. But obviously, I mean, as spine surgeons, we do know that conservative treatment plays a huge part. I mean, unless you do proper and sort of a dedicated conservative treatment, which includes actually pain blocks, you should not jump to surgery. So it's a very important part of your armamentarium as spine surgeons. I'm very happy that Deepak is something of a innovative sort of a workshop for surgeons. Normally what happens is that pain is the domain of by and large anesthesia people, but especially in private sector, I mean, I think all the spine surgeons are, no spine surgeon will send a patient to anesthesia for a block, nerve block, SNRB. So I hope that you do focus of SNRBs and all type of blocks, and it's a very, very important part of your skill set as spine surgeons, that you learn these blocks. I mean, there's no point. I mean, a patient comes to you, especially in private practice. I mean, government setups, busy institutions, they don't have time, but especially in private sector, you should know. I mean, you can't send a patient with pain who comes with you, say radiculopathy. If he comes to you, you have to give a trial of at least SNRB to make sure that it's diagnostic as well as therapeutic. So you have to make sure that it is because of the compression on the nerve root that it's causing pain. So I mean, learn it well. I mean, it's a very, very big opportunity. And obviously, I mean, short of doing live on the patient, if you do in cadaver, it gives you a huge amount of confidence. So you have the exact anatomy as in a patient. So it's a big opportunity. If you go out, I mean, those of you who have attended these cadaveric workshops abroad, the fees is tremendous. You cannot imagine. I mean, almost $1,000, $1,500 for one cadaveric workshop. I mean, that's huge. And you are having it, I think, just about 10 to 15,000, whatever is the fees. It's a minuscule amount as compared to the West. And the facilities and the cadavers are nearly the same. So maximize your output and benefit from this. I'm sure that Deepak has organized a very trained and expert faculty for this. What I would say is that you should do as much hands-on as possible, okay, in this, and take your time and maximize your benefit. Thank you so much, Deepak, for organizing this, and Department of Neurosurgery. Thanks.
Thank you so much, sir. Now I would request Professor Kale, sir, Head of Department of Neurosurgery and the Chairman of the symposium, to grace the podium and shed light with his long words of wisdom. Thank you, sir.
Dr. Kamran, Chief of Trauma Center, Dr. Vijay Sharma, Dr. Deepak Agarwal, other faculty colleagues, residents, fellows, delegates who have come all the way to attend this unique workshop. Pain procedures in cadavers. I don't think I have seen this before in AIMS, at least. Maybe it has been done elsewhere, but that's very nice. That's very good. Hands-on experience on cadavers is the basic block of teaching and of learning. Once you do it on cadaver, you will be able to replicate the same process on a real patient. And like Dr. Kamran has already expounded, pain procedures are most important now. The way spine surgery is kind of mushrooming, this is one part which has been totally neglected. Everybody is into operate, fix, put screws, rods, discectomy. While these procedures sometimes they work so beautifully that patients can avoid surgery indefinitely. And that's what I keep telling the patients. Try this for 2 or 3 months. Maybe you can avoid surgery indefinitely. And the classical teaching used to be that for every radiculopathy, you wait for 8 weeks, 12 weeks with conservative treatment. And only then, or if there is increasing neurological deficits, I mean, there were certain laid down criteria that you rush for surgery. But now what I see is any black disc surgery. Terrible, terrible. Anyway, you have experts here. I mean, the pain clinic in AIMS was started and run by the faculty who is going to teach you for the next 2 days, today and tomorrow. Or maybe he's going to be here only for 1 day. That is for? Dr. Dureja is the one who's credited with starting the pain clinic in AIMS, and it used to be a very successful clinic. And now the same legacy is being followed by Dr. Dhruv. So I think you have excellent teachers for today and tomorrow. Make best use of this opportunity, learn the basic procedures, and I'm sure you can have many patients avoid surgery indefinitely, because if the pain procedure works, especially in the elderly, and now as the average age of Indians keeps on increasing, you will see more and more 80 years old, 85 years old, 90 years old with pain. Not every 90-year-old you are going to take to the OT. Not every 80-year-old you are going to take to the OT. So these pain procedures are the mainstay, especially in the elderly. So make best use of this. You have 2 days, you have cadavers, you have excellent faculty to guide you. And the cadaver facility in AIMS is very well equipped. It might be small, but it has all the necessary equipment, including C-arms and microscopes and endoscopes and drills and everything. And OAM. So it's very well equipped. So make best use and learn well and enjoy the next 2 days. Thank you very much for your attention.
Thank you very much, sir. Before I proceed, I would like to request Dr. Surya to honor our chief guest and our prime faculty, Dr. Dhruv, with a bouquet as a mark of our gratitude and respect. Thank you, sir. Thank you, sir. Now I would like to request Dr. Ramesh Dedumani sir, felicitate Professor Bhoi, the head of the Department of Emergency Medicine, with bouquet as a mark of our respect, sir. Thank you very much, sir. Finally, I would like to request Dr. Ramesh to add in with a vote of thanks and help us embark on this journey to begin with the symposium. Thanks, sir.
Thank you, Rakshay. Again, I welcome you all again for this Cadaveric workshop. And all the dignitaries in the dais have already spoken so many things. And I would really like to thank all the dignitaries in the dais, especially Professor Kale, who's the backbone of our department. You can say he's a pillar, and he's always a person who's we can fall back upon, and then he supports us in every endeavor which we do in the department. And because of his vision and his love for the department, we have been progressing leaps and bounds. Again, Dr. Kamran and Dr. Vijay have been in the trauma center. They have been very supportive for us, especially Dr. Kamran, who always thinks about cadaver workshop, which is very important. And then Dr. Vijay, again, he is trying his level best to get this constant chain of cadavers, and he has always been like promising in that. And I hope in coming future, because we have some collaborations being made, and then we will get to have a lot of cadavers in the futures for these workshops, and I hope it will get better and better with time. Dr. Deepak Agarwal, I think everybody knows, and he is our troubleshooter. Whenever we have any issues, and he's the one, he takes care of things just like that, and he's always been behind this cadaver workshop. He's one of the minds. So rest, I would like to thank all my faculty. I can see Dr. Dattaraj, my colleague and friend here, Dr. Surya, Dr. Shantanu. So we hope to expect, because others are busy probably to come in the day. And especially all the delegates who have come here. I'm glad that we had an introduction before this meeting that there's one delegate from Bahrain, 2 of them are from Libya. So there's one more expected from Malaysia, but due to some reasons he couldn't make it. Professor Bhui and Dr. Dhruv for being here for this workshop. heartily thank them. Tomorrow we will be having Professor Duroja and Dr. Ashish Tandon, who is again a neurosurgeon from Jabalpur. So that is for tomorrow's workshop. The topics will be the same. The cadaver hands-on will be the same for tomorrow as well. Only thing is that the faculty will be changing, because you cannot ask people who are busy working outside to be off for 2 days. So that's the theme. That's why we have divided this into two batches. And I would like to thank our scientific sponsors who have been supportive for this workshop especially. And all the staff members who have been behind this workshop, who have been working along with the team, especially Dr. Rakshay and all the other residents who have been helping me out. It would be unintended if I have been missing somebody, so please forgive if I have missed somebody. So with this, I would like to end this vote of thanks, and then we can break for a breakfast now, and then we'll get back with the scientific program. Thank you very much for coming here. So we begin with by 9:30 a.m. So finish your breakfast and then